Hello everyone and welcome to another episode of our Frontline Voices podcast. I am Liz Dawson and I am the Director of Communications and Involvement at South Tyneside and Sunderland Trust. Today we're here to talk about something that affects so many people in our region, and particularly at this time of year, lung health and smoking. I'm delighted to be joined today by Dr Ruth Sharrock, who is a respiratory consultant here at the Queen Elizabeth Hospital in Gateshead, and Rachel McIlvenna, who is a strategic manager looking at our smoke-free services right across the North East and North Cumbria. I'm going to start by asking you both just to introduce yourselves and tell us a little bit about your roles. I'll come to you first, Ruth, because you're on my left.
So I'm Ruth Sharrock, a respiratory consultant here in Gateshead, but I'm clinical lead for tobacco for the ICB as well, and also lead on health inequalities and lung cancer, and obviously they're all intimately linked, so very lucky to be working with Rachel on the tobacco agenda.
Thanks, and I'm Rachel McIlvenna, so I'm the Smokefree NHS Strategic Manager for the North East North Cumbria, and over the last 4 years I've been leading around the implementation of the long-term plan within our secondary care settings, looking at the acute, inpatient and mental health pathways, but also thinking about how the NHS can see some of those opportunities to intervene. So for instance, thinking about severe mental illness population, looking at lung cancer checks and our workforce who smoke.
Thank you. I wondered if we could start by just having a conversation around, I guess, the context of where we are now in this region in terms of, I guess, smoke and prevalence, what we've seen over the past 10 to 15 years in terms of the changes in that.
I think we're in a really fortunate position. Obviously, originally the North East with high levels of deprivation and heavy industry was associated with some of the highest rates of smoking in the country, and with that came the highest levels of ill health. So things like lung cancer, threefold more prevalent in the North East than in our most affluent areas of the country. So that was kind of really holding back the region's health. But we've had, over the last decade, such good coalition between directors of public health. We've had a regional tobacco control programme in the form of Fresh, and then NHS recognition of the pivotal role that they play in identifying smokers and giving them better help. And sort of all of those partner agencies working together at a regional level has completely transformed the landscape. So we've gone from having highest levels of smoking prevalence to the fastest decline in smoking prevalence seen in England in the North East. So we are in a good position. We're definitely not there yet. We've got a vision for a smoke-free future, and when we always want more. We want to go faster than we're going already, and a bit like Rachel articulated, there's some pockets in our communities that need the most enhanced effort, and we've put a lot of energy into expectant mums or people with serious mental illness, our routine and manual workers, especially those in our anchor institutions. So we've made great inroads. There's still lots to do, and what we need to do increasingly is becoming more targeted.
Yeah, and I guess that's fantastic, isn't it, that we've seen such a decline in our region. I think one of the fastest. You were telling me earlier, Rachel.
I was indeed. So across the North East, our rates are now 10.2%, and across the North East and North Cumbria, it's 10.4%. So we're on par with England, which is just something we've never done before. And I think it's just really important to note that while for the general population, those rates are coming down, for our most deprived groups, we're not seeing that sharp decline. So that's why there's still a lot of work that needs to be done around meeting the needs of our underserved population.
Yeah. And I guess what we're still seeing is actually what hasn't changed is that smoking is still one of the biggest drivers of, ill health and the serious illness that we see. I mean, Ruth, you can probably tell us about some of the patients that you see in your role as a consultant and the impact of that on their lives.
Yeah, for sure. So both for them and for healthcare providers, I guess, when you think about respiratory health, the bread and butter, most of what I am seeing is smoking-related consequences, people with COPD, emphysema, lung cancer, complex respiratory tract infections, all kind of deeply embedded with the fact we've had a higher smoking prevalence in our areas in those communities. And we see the same patients kind of come again and again with problems. And really the key to being able to help them change that trajectory is to be able to offer robust stop smoking support at the time they need it most, which is when they're in a crisis and in hospital. And that's exactly what the long-term plan has empowered us to be able to do. We've now got tobacco dependency treatment teams in our hospitals, seeing all our smokers on an opt-out basis, just offering them products and support for either temporary abstinence while they're in or for a quit attempt if they're ready from the outset, But even those we're just helping temporarily, it's often building confidence in products and they go on for a quit attempt. So we're changing the course of their clinical condition, not just, making it easier for them to be in hospital. So it has a massive impact, and the two are intimately linked, the smoking prevalence and the burden of respiratory ill health in the region.
Yeah, and I guess we were talking as well, weren't we, Rich, about that mindset of actually this is about helping people with their dependency and treating that and getting them the right support.
Yeah, we definitely changed the narrative around considering smoking as a lifestyle choice, but seeing it more as a chronic relapsing long-term condition that requires treatment. And as Ruth said, there's just a range of support that is now available for people to get off that dependence of tobacco, because tobacco impacts not just the individuals, as Ruth has said. Tobacco impacts on all the organs in the body, but it also blights families and communities, because for every person that dies as a result of smoking-related illness, there are about 10 of them that suffering from smoking related conditions as a result of that. So people are losing loved ones daily and then living in ill health because of tobacco. So it's really important that we put that in context and see how far we've come, but there's still so much that needs to be done around this agenda.
I guess which is why the NHS long-term plan and the 10-year forward vision is so important, that whole strand around prevention. I guess what we're talking about is that in action. It takes a while for that to work through the system, doesn't it? And for us to see some of the results, but so important that we've now got that tobacco dependency treatment services embedded in what we're doing in our services. We're still in the throes of winter. I'm hoping it's going to stop raining sometime soon because it's just relentless. Ruth, I guess probably a question for you. At this time of year, do we see more people with lung conditions coming into hospital, and how does that manifest itself in the colder months?
Yeah, absolutely do. All trusts are sort of blighted by winter pressures, aren't there? And a huge surge in demand, and about a third of that is respiratory ill health. And it affects, as you've said, people with underlying respiratory conditions even more so. So we're all more vulnerable to coughs and colds in winter. But if you have COPD, emphysema, underlying problems with your lung health, you're even more vulnerable. And for those who smoke, another level again. So we know people still smoking are more likely to get respiratory tract infections and get them more severely, be more ill, or more likely to be hospitalised with flu. There's quite complicated reasons as to why they're more prevalent in winter. Your body's immune system isn't working as effectively, lower vitamin D levels, but also people are crowded together, and the cold weather affects your immune system as well. So we see the peaks in the viruses, and they affect people, especially those who still smoke, most profoundly. Like I say, it's a third of what's coming into our hospitals in winter. And when we look at evidence-based interventions, things we can do to reduce how many people are needing acute services, frontline services at this time of year, the two really strong themes are helping people to stop smoking and obviously getting people vaccinated, and especially the people who need it most to get vaccinated. So
against flu,
yeah, and obviously there's other respiratory infections you can get vaccinated against. There's different cohorts for that, but flu in particular, and that's what we've seen this winter, is a huge surge and burden from flu admissions. As regards helping people stopping smoking, we know UK data shows a 15% reduction in readmissions if we can get people to stop smoking. So if they come in one admission, what I was seeing kind of 5 years ago when I didn't have any embedded support in the trust, you kind of see the same people coming in every month. You just get them better, go home. We haven't helped them to stop smoking. They're back in the same position again a month later. And now we've got really robust help to help them become smoke-free, and seeing them not keep coming back and actually enjoy a better quality of life, get out more, and all the things that help you be less likely to succumb to infections.
And how does that, can you explain, I don't know if this is one for you, Rachel, but how does the tobacco dependency treatment service work? So we've now got this embedded in our system. So we've just heard from Ruth that, people are coming in, particularly at this time of year with, respiratory conditions. And how do we then embed that support for them to help to stop smoking?
Yeah, that's a really important question. So we're really privileged that in the North East Cumbria, all our 10 hospital trusts have in-house tobacco dependency teams in there. And so when a person is admitted to hospital, the admitting team will do a screening assessment to identify if they're a smoker, and of course if they have other long-term conditions. once that is identified that there's a smoker or a recent ex-smoker, we usually say within the last 2 weeks, then they will have a referral to the in-house team, who will then come and sit them, speak to them, understand their tobacco use and understand what they would like to do. For some people at that stage, they are really, really poorly, and thinking about quitting seems like a long-term goal that they might not be able to grasp. So at the moment, the priority of the team is to support them with managing that tobacco dependency while they're in hospital. They are offered a treatment plan or a care plan. They're offered medication, and there's a whole range of medication available, and they work with them around that. And for some people, they think, right, this is such a teachable moment. I've come into hospital and actually I've been thinking about quitting smoking for a long time, but actually I'm going to give it a go. And the team is there on hand to offer compassionate, flexible, person-centered support and help them. And then once they get discharged and they're out of hospital, there's a treatment plan in place for them to be supported while they're in the community. So it's a whole wraparound care for those people, but it's not judgmental. It's understanding that people have come there, and for many people who present in hospital have been smoking for decades. You're just not going to stop, but we know that the best way is with expert support, and that's what the teams that we have in our hospitals are there to do.
Is it ever too late to stop?
It's absolutely never too late to stop. Like, the benefits are immediate. So things like if someone's come in and they're suffering with a respiratory infection and their oxygen levels are low, even just not having another cigarette, your carbon monoxide levels fall, your blood's more free to carry oxygen. So even in that next hour, 24 hours, you're reaping the benefits in that moment. But even long-term outcomes improve with stopping at any age, at any point. Things like even at the point of a diagnosis of lung cancer, stopping smoking increases your life expectancy, even at that point. So it's absolutely never too late.
Yeah. And it's great that we've got that support now in place. But I imagine it is still really difficult. I guess when you're in hospital, it is a time of stress and anxiety for people. And often having a cigarette is their coping mechanism. So how do you sort of break that barrier with people and get them to, I guess, change that mindset and get them the right support?
I guess, like Rachel's saying, our specialist advisors are, the absolute experts in this, and they really help people to understand the different components of that addiction. The thing people are addicted to is nicotine. It's desperately addictive. And that kind of feel-good feeling that you have when you have a cigarette in that moment is because your nicotine's activating all your dopamine receptors. You're getting that kind of neurological high. And all the things that you've set up around that moment, whether you've gone outside, you're getting some fresh air, you're getting a break from kids or work, or all of that makes it feel like a moment that's helping you to cope and a bit of respite and relief. But actually, when you unpick it, that's not breathing in tar that's making you feel like that. That's just killing you. And we can give you the nicotine separately, and you can do other things that give you some headspace. And so the behavioural support is unpicking those components. Let us give you plenty of nicotine. Let's find the right products for you to mean that you're not stuck in that cycle of cravings, because along with the highs come the lows, and then thinking, when can I next have a cigarette? Can I afford some more cigarettes? How am I going to get them? And so you're stuck in that cycle of, yes, a brief high when you have a cigarette and then a low afterwards, and you're trapped and you're kind of a victim to nicotine. If we could break that, and as part of the support process, you're having nicotine either via a vape or patches, or there's tablets now to help break the cycle of nicotine addiction in the brain. And we're just separating out those component parts. And actually, the evidence is that your mental health and stress and anxiety is all better when you don't smoke. So it's kind of just unpicking that myth that the smoking makes you feel good. It is not breathing in cancer-causing tar and denying your body of oxygen that makes you feel good. It's one component. We can give that separately. We can lose the rest, and we can get you back on track. So it's just, that's what our advisors do, and they're really good at it.
Yeah. And all of that support's available on the NHS, the products and the patches. And
absolutely. And just to add to what Ruth said around that temporary relief that people get when they smoke, that's what it is. And when you unpick that, we know that smoking is concentrated in our most deprived populations, and most times people are using that to mask and self-medicate. And for some people who are using psychiatric medication, it can cause a reduction in the dosage of that, which then overall improves their physical health as well. So it's all positive for people.
Yeah, it's fantastic, all the support that we've got in place for people. This might be a tricky one to answer, but what's the one myth about smoking and lung health that you'd want to get across to anybody listening to our podcast today?
That is a tricky one. I think, I mean, people come with lots of myths, and often it's about what someone told them, someone they knew stopped smoking and then got an illness, or they've heard this about vapes, so they don't believe what I'm saying about vapes. But I think the theme really is people think things aren't going to happen to them, that they're smoking, and they think, well, I feel all right. It's not really having any effect. I'm getting away with it. And obviously by the time they're in front of us in healthcare, they're not getting away with it. And it's really scary for them in that moment, and a real kind of realisation, this is catching up with me and I have to do something about it. And it's such a shame that it's kind of left to that point. Obviously we have a really powerful impact when we give them help and support at that time. But I think people thinking it's not affecting them and getting away with it is sad. And I've often got a patient in front of me maybe with a new lung cancer diagnosis, and if other younger family members are there too, that kind of penny dropping, this is the path we're going to follow if we don't do something now. So I think thinking it's okay for some people, or that they're getting away with it, is the real myth we need to unpick.
Really powerful. Anything from you, Rachel?
I think it's probably more to healthcare professionals and professionals in general around, there's still that misconception that smoking is a choice, and we know the impact that the tobacco companies have on perpetuating that and introducing young people to tobacco, because it is it's a childhood disease, as it were, because most people start when they are young. So getting health professionals to change their mindset that people need support and that it is a treatable disease is something that I would say needs more.
You mentioned there, Ruth, about the sad circumstance when you are having to explain to people they've got lung cancer. One of the big developments we've had over the past couple of years is the Lung Check programme. Can you tell us a little bit about that?
Yes, so it started out as the Targeted Lung Health Check programme, and there were a selection of pilot sites, around 10 in the country. Newcastle Gateshead was one of them, to get going quite early, obviously, amongst all of COVID. But in North Cumbria, we've now got full geographical coverage for our whole footprint, and it's becoming the lung cancer screening programme and part of the national screening programme. But because we had a head start, we're in that, and we needed it. As I said at the start, we've got threefold the incidence in our poorest communities in the North East as we have in the most affluent areas of the country. And it's a very time-sensitive condition. There's huge benefits from catching it early when it's completely treatable. Because of that rollout and the speed at which the ICB have sort of facilitated that happening, we account for 10% of the lung cancers found nationally are in the North East. Wow. So we're playing a huge part in that, and it is completely transforming the patients I'm seeing in front of me. It used to be a condition that often presented in quite late stages with very poor outcomes and not many treatment options, and now we're seeing people caught very early, a year or so before they would have had any symptoms, and can be cured. And so I'm having far more of those sort of conversations than the palliative ones I was having just 5 years ago. So it's completely transformed what we're seeing. Yeah. But it again, a really good opportunity to remind people who might be listening to just take it up. It's not scary. They're a lovely nursing team. The people that do the calls with you. People are invited between the ages of 55 and 74, if they've ever smoked, have a telephone interview and work out your risk of lung cancer. And if you're in a higher risk category, which is about half of people, you're invited for a CT scan. And it's a very low dose, quick CT. It's not much different to an X-ray, but you're kind of lying down, you quickly go in and out of a scanner, no injections. We were so lucky that we got going early, and we've got full coverage, and just really encourage the people who have got most to benefit from taking part to take part. And if that's your relative, just give them the nudge to open that letter. Absolutely. Or answer that call, because it's well worth it.
Absolutely. It can be a devastating diagnosis, can't it? But it's fantastic that we're now able to prevent some of that.
Yeah, we have just started a pilot in the Newcastle Gateshead area where we're going to have an enhanced team who are supporting those people who are a bit ambivalent about quitting smoking and not quite ready to engage with the Stop Smoking service, but at a risk, and to support them, providing them with treatment and behavioural support as well. So again, really exciting.
Really exciting.
Lovely, thank you. Well, it's been great talking today. I guess I wanted to just end on what are you most hopeful for? I'll come to each of you for the future. Will we see a smoke-free generation, and what gives you most hope in terms of what we're doing right here in the North East and North Cumbria?
I'm confident we're leading the way in the North East as we're collaborating across healthcare, DPHs, local authorities with the Regional Tobacco Control Programme. And I am most reassured that we are not taking our eye off the ball for the people who need the help the most. Because I think it's very easy to do, quick wins or some themes like using digital resources and things. They're really helpful for some, but we're very acutely aware of people who get left behind with some of those programmes, and we are given the opportunity to say that's great resource for everyone, but we need a targeted resource for this. And we've kind of consistently worked through those populations to be able to make sure that what we're doing is equitable. And so that's what really gives me hope that our clinical voice from the frontline is heard, and that we can make sure that resources get to the people who need it most.
I think from equally, as Ruth has said, I'm so optimistic about the future, because I definitely see a future where smoking becomes a thing of the past, where children are growing up where no one is smoking and everyone who's currently smoking stops. I think with the range of treatment options that are available now, we've got new medication on the market, we've got teams that are based in local authority and also within the NHS. We're giving smokers absolutely all the opportunities they have to quit. And I just wanted to mention, because I have to mention, that if anybody was wondering about the range of services, we've got a whole range of services commissioned through our local authority stop smoking services, and some are available within community pharmacy. There are also digital routes, so now more than ever there are so many routes and ways for people to quit. And if anyone was wondering about where the support is in the North East and North Cumbria, I'd say go on to the Fresh Quit website, so that's www.freshquit.co.uk for information around the services. So the ICB committed to this agenda. They signed the declaration for a smoke-free future alongside Fresh and the 12 North East local authorities, so demonstrating that this is something that they see that is going to happen in the future. So very, very optimistic about our future.
And I mean, the position we're in as a society with the current legislation is so inspirational, isn't it? I think the generation above us, so like my parents' generation, my dad's got COPD and emphysema, my mother-in-law's got COPD, her twin sister's got COPD and emphysema, my father-in-law's had a recurrent throat cancer treated, an entire generation blighted by smoking-related disease, and we all see that. And my children, hopefully, won't ever be able to buy a cigarette. So that's the kind of timescale that this transformation's happening. We just have to put all our weight behind that to get it through the next stages of Parliament, but it is within our grasp, so it's super exciting.
Fantastic. Ruth and Rachel, thank you so much for talking to me today. I can tell how passionate you both are about this subject, so please keep going and keep doing what you're doing, because you are quite literally changing the lives of lots of people across our region. So thank you.
Thanks,
Liz.
Liz.
Thank you.